morning, students. Today we have Dr. Santosh Dighe, Associate Professor, Department of Pharmacology, Ravara Rural College of Pharmacy. He is working as IISc nominee at our college, and he is helping us since last 2-3 years for various issues regarding animal ethical health. He has more than 12 years experience in his field. He completed his PhD, and I hope he has very good knowledge in this pharmacology. So, in this context, I request Dr. Dighe to kindly guide our students on topic pharmacology. Please proceed, sir.
Okay, thank you, sir. First of all, I'm very much thankful to Dr. Nirmal, sir, to invite me as a guest lecturer to your esteemed organization. As sir has told, so I'm in a teaching field from last 13 years. So definitely, I will try to give you a good knowledge regarding pharmacology. So as per the assignment given, today I'll give a brief knowledge about the chemotherapy. Correct. Now, as you are the students of B Pharmacy, so you are well aware about that. We should know about the thorough knowledge of the medicine, not only the medicine, but we should know the basic thing about the what is the exact mechanism of action and their application of the medicine. Correct. Now you know very well during this pandemic situation of COVID-19, we have suffered a lot, and we have done lots of tremendous experiments for the use of the medicines. Correct. So what I request you to all the aspirant students that you just try to acquire a good knowledge or thorough knowledge about the medicine, so that that will be helpful to save the humankind. Correct. Now we'll start with our topic. So as you can see here, that the chemotherapy is what we can say that it is the use of the chemicals. Correct. You know very well, therapy means application, or we are using lots of drugs. What is the definition of drug? Drug is a chemical which is used for the treatment, diagnosis, and prevention of the diseases. Correct. So you know very well, whenever any chemical which is used for the treatment, diagnosis, and prevention of the diseases, that is converted into the medicine. Correct. So every medicine is chemical, but not every chemical is not one of the. So we cannot say as every chemical which is used for the medicine. So over here, the chemotherapy is the use of the chemicals to eradicate the parasites, bacteria, viruses, or cancer cells in the body. So you must have heard that we are using lots of chemicals in the medicine for the treatment of the parasites, bacteria, viruses, or cancer cells. So it depends on the drug which is being selectively toxic. That is toxic to the cell of the parasite, but not toxic to the human beings. It's very important that whichever chemical or medicine you are using, it should harmful to the parasites, bacteria, viruses, not to the human whole cells. Correct. So it should not interact, or it should not alter the normal physiological functions of the your human bodies. Correct? So that is the exact definition of the chemotherapy. Now we'll see that what is the difference between the chemotherapy, what is bacteriostatic and bactericidal. So you, as you are aware very much that the static means inhibition and sidal means killing. So the bacteriostatic means it arrests the growth of the replication of bacteria at serum level, non-toxic to the patients. So what is the main function of the bacteriostatic? Inhibition of the growth and replication of the bacteria at the serum level, which should be non-toxic to the human host or the patient. Thus, which limits the spread of infection. Means in simple word, bacteriostatic chemicals inhibit the growth. It doesn't kills. Correct. So that's the main function or mechanism of the bacteriostatic drugs. So, what are the examples? So, the examples are erythromycin, tetracycline, chloramphenicol, as well as sulfonamides. Correct. So we'll have to see the classification of all these antibiotics, and that time we'll see what are the exact mechanism, how they are classified. So right now you can consider only the bacteriostatics example are erythromycin, tetracycline, chloramphenicol, and sulfonamides. Now, coming to the next point, that is what is the meaning of bactericidal. So as the name indicates, cidal means to kill. So bactericidal are killing the bacteria. What are the examples? That are the beta lactam antibiotics and aminoglycosides. So if you see the overall classification of the antibiotic, in that these are the very important drugs which are having the effect on various treatments of the disease. So as I have explained you, the properties, that is cidal and static, can depends on the antibiotic concentration in the blood. You know very well that if you say that any drug is effective, what are the parameters through which they do have the 100% efficacy? That is, if the drug is reaching at the site of action, or you can say at the receptor level at the maximum concentration, then you can get the more efficacy. So the concentration of the drug or the antibiotic is very much important, which is reaching. It may be in the systemic circulation and as well as at the receptor level. So it the concentration it depends whether it is cidal or the static, whether it is only inhibiting the growth or whether it is killing the bacteria or the viruses. So the examples already we have seen, that is erythromycin, clindamycin, as well as other drugs which, if we are taking at a higher concentration, they are acting as a bactericidal. At the lower concentration, they are acting as a bacteriostatic. Now, we'll see the classification, or first of all, we'll try to understand what are the uh, important ways through which they are classified. The spectrum of activity. You must have heard it is a narrow spectrum or the broad spectrum. Correct. So, as it relates to the number of microbes that are susceptible to the action of the drug. So, if you say the narrow, means it is a limited number. If it is, we are saying as broad. So what is the meaning of broad? Broad means wide. Got it? So the narrow spectrum and the broad spectrum. These are the two major classification through which they have classified as per the spectrum of activity. Now we will see the penicillin G is a narrow spectrum drug, as it is only effective against gram negative as well as gram positive microbes. So we know that there are two types of the microbes, gram positive and gram negative. If we are adding the stain, if they are getting a color, so we can say it is a positive. If it is not getting the color, then we are saying as a gram negative. Correct. So penicillin G is a narrow spectrum. Why? Because why we are saying as it is a narrow spectrum? The reason behind that is they are only specifically acting on the gram positive microbes. Now coming to the next example, that is tetracycline. So these tetracyclines are effective against gram positive as well as gram negative microbes. That is what we can say that tetracycline is acting as a broad spectrum antibiotics. Correct. So it's very important that if you want to classify the antibiotics or chemotherapeutic agent depending upon the spectrum of activity, we have to focus mainly on whether they are acting on the gram negative or gram positive. If they are acting on the both gram positive and negative, then we have to say that they are acting as a broad spectrum antibiotics. Now, you know that whenever we are using any chemicals, so every microbes, they do have the effective, that they after some days or after some times they create a resistance, they alter. You know that right now, only in the COVID-19 situation, previously uh, there was only 4 or 5 strains of the COVID-19 were there. Right now you can see lots of strains are coming out. Why this is so? Because they are creating certain mutation, and they are creating the resistance to the existing chemotherapeutic agent. Same thing is over here. You can see that what is the meaning of resistance. The resistance may be either acquired or the innate. So the resistance is nothing but the loss of efficacy of given antibiotics against the particular strain. Now you should be knowing about what is meaning of strain, what is what about the acquired resistance, innate resistance. So the frequently Staphylococcus aureus as well as Pseudomonas aeruginosa, then Mycobacterium tuberculosis. So these they creates the resistance to the particular antibiotics. The mechanisms which are responsible for resistance to antimicrobial drug, which includes the following mechanisms are there. First one is inactivating the enzyme that destroy the drug, that is whichever enzyme is involved, it get destroyed. So microbes may increase the manufacture of the drug metabolizing enzyme, that is penicillins, decrease drug accumulation, that is microbes may cease active uptake of certain drug, example is tetracycline, alteration of the binding sites. Yes, definitely. You know that the receptors are having a certain binding sites, so that they can alter the binding sites. Change in the receptor, which decreases the antibiotic binding and their action. The examples are aminoglycosides and erythromycins. Development of alternative metabolic pathways. Microbes likewise may synthesize or modify the compounds which have little or no affinity for the drugs. So you can see there are main four mechanisms through which there might be a alteration in the effect of the antibiotic, or we can say as a resistance. First one is inactive enzyme, inactivation of the enzyme, decreased drug accumulation or uptake, alteration of the binding sites, or development of the alternative metabolite or metabolic pathway. So these are the one of the reason through which there are chances of the enhancement of the resistance. Now, what are the complications? You know that several times, if the physicians has to give the antibiotic, they are not starting from directly the antibiotics. म्हणजे सुरुवातीलाच फिजिशियन कधीही अँटीबायोटिक प्रिफर करत नाही. तर त्यासाठी खूप रिझन्स आहेत वाय अँटीबायोटिक्स आर नॉट प्रिफर्ड ॲज अ फर्स्ट लाईन ड्रग. Yes, if you are not getting the recovery from any other drugs, then you can go for the antibiotics. So what are the complications? Definitely these antibiotics or chemotherapeutic agents they do have certain complications. First one is hypersensitivity. It is frequently occur. You know that lots of people they do have the allergic reactions. So, what are the allergic reactions? The penicillins can cause a serious hypersensitivity problem ranging from rashes, urticaria, or anaphylactic shocks. Second one is there are chances of the direct toxicity. Yes, high serum level of antibiotics may cause the toxicity by affecting the cellular process in the host. So there are chances of alteration in the cellular process, so that the normal physiological function it may get hampered. Examples are aminoglycosides, which can cause autotoxicity or nephrotoxicity. Yes, whichever antibiotics you are consuming right now, lots of huge use of the antibiotics we have taken. We know that in the COVID-19 situation, there was a corona kit, and that lots of antibiotics, even though it is not recommended by the physician, the people are voluntary has consumed the antibiotic. I think all the people has taken the antibiotic during this pandemic situation as a preventive measure or the curative measures. Correct. So, but they do have certain complications. They do have certain adverse effect, and that we were talking, that is, it may lead to the hypersensitivity action or direct toxicity, or it will lead to the super infection. You know that this mucormycosis is also called as this super infection, because they had decreased the immunity power, and due to that opportunistic infection or the super infection has occurred. So this is a live example right now we can see in the market. Lots of people who has been taken the treatment of this antibiotic, or it may be a higher steroids. They are suffered from this mucormycosis. So in the broad spectrum, antimicrobial agent or combination of agent can lead to the alteration of the normal microbial flora of the upper respiratory intestinal as well as GI tract, which lead the overgrowth of organism, especially fungi. So that was I was talking. The fungal infection may lead to the super infection. Correct? So these are the one of the complications of the antibiotic therapy. Now, we have seen the introductory part of the what are the we'll just overlook that what is the definition of chemotherapy, what is the difference of bacteriostatic, bactericidal, then what are the spectrum of activity, whether it is a broad spectrum or narrow spectrum. Then we have seen the what is the resistance, how what is the mechanism of the resistance is created, then what are the complications of the antibiotic therapy, which are the hypersensitivity, direct toxicity, or super infection. So that's what we should restrict the use of the antibiotic. We should not frequently use the antibiotics. Now, what are the mechanism through which these antibiotics are acting? Correct. Now, first of all, to start with the antibiotic, we must be knowing what is the meaning of antibiotics. I just now we have seen the definition of the chemotherapy. Likewise, the antibiotic means a natural substances which produced by the microorganism to kill the another. Correct. So you know very well the microbes are killed by another microbes. So it's the natural substances, correct? So it might be no doubt we can prepare synthetically, but it's a natural substance, correct? So anti-infective and antimicrobial. So any agent, natural or synthetic, that kill a pathogen, that is called as antimicrobial or anti-infective agents. So this is the basic difference between antibiotics and antimicrobial drugs, correct? So now we'll see the classification of the antibiotics. Now, you can see on the screen that the classification is based on the over here mechanism of action. We have seen the classification based on the spectrum of activity, whether it is broad spectrum or whether it is narrow spectrum. Over here, you can see on the screen the classification is based on the mechanism of action. Now we'll see one by one. First is cell wall synthesis inhibitors. Now, you know very well, if you see the structure of the cell wall is outer covering which is very much important and having the function of the protection, and they are holding all the cell organs, correct? So these cell wall synthesis inhibitors, examples are beta lactams. In beta lactams, penicillins are there, cephalosporins are there, astrozones are there, and imipenem. These are the classical examples of the beta lactams. Then, what are the polypeptides? They are the bacitracin, vancomycin. We'll go one by one how the cell wall synthesis inhibitor are acting as a or how they are killing the microbes. Second class is protein synthesis inhibitors. You know very well the protein synthesis is key process which are having importance so that all cellular activities or physiological functions are properly done through the if the protein synthesis is working. If there is impairment in the protein synthesis, that will be the hampering of the normal physiological functions, which may kill the that microbes. So what are the examples? You can see aminoglycosides are there, tetracyclines are there, macrolides are there, chloramphenicol, clindamycin. So over here you are not focusing on the spectrum of activity. Over here you are focusing on the basis of their mechanism of action, whether the drug is inhibiting by cell wall synthesis inhibitors or protein synthesis inhibitors. Third class is folate antagonist. You must knowing that sulfonamides are there, trimethoprim is there. These are the two drugs which comes under the folate antagonist. And last class is nucleic acid synthesis inhibitors, where the quinolones are there, correct? So these nucleic acid synthetic inhibitors are also having the key role that they inhibits the normal function of the cell. Now we'll see one by one. What is the cell wall synthesis inhibitors? Okay. Now, uh, what is the beta lactam? In the 1928, this Alexander Fleming observed that antibacterial effects of the penicillin. So, the Alexander Fleming has invented the penicillin, and in the 1940, the Flore and Chen extract the penicillin. So, this beta lactam ring is very much important. You can see on the screen these beta lactam ring. They do have the effect which inhibits the cell wall synthesis. Correct. If you break down this beta lactam ring, what will happen? The activity or the effect of the penicillin is inhibited. So beta lactam ring is having the main importance for the activity of these antibiotics. Now, the classification we have seen the penicillin and the cephalosporin. Again, these penicillins are further classified into narrow spectrum, that is penicillinase sensitive and penicillinase resistance. So, the penicillinase sensitive antibiotics are there and penicillinase resistance, but they do have sensitivity towards the penicillinase, and certain drugs they do have the sensitivity towards penicillinase resistance. Now we coming to the next point, that is broad spectrum penicillins. So I told you that what is the meaning of narrow and broad. Narrow means they are acting only on either gram positive or gram negative. Broad means either they may act on both gram positive as well as gram negative. And what is the extended spectrum? Other, if they can extend the spectrum to other variety of the organisms. So that is the main classification for the penicillins. Another classes are cephalosporins, carbapenems, monobactams. So these are the various classes of the cell wall synthesis inhibitors. Now, you'll see that wherever you are using the classification in the antibiotics, you have to classify depending upon their mechanism of action or spectrum of activity. If you want to classify depending upon the mechanism of action, again they have sub-classified whether they are first generation, second generation. Now you can see on the screen that inhibitors of cell wall synthesis, they are of again classified into two: beta lactam antibiotics and other antibiotics. Beta lactam antibiotics means what? The examples you can see, the penicillins are there, cephalosporins are there, carbapenems are there, monobactams are there. And again, these penicillins are further classified into penicillin G, penicillin V, methicillin, nactacillin, oxacillin. There are n number of what we can say the examples which comes under the class of penicillin. So you have to bug up only 4 5 as a example. so that you could understand what is the basic mechanism of these penicillins and what are the examples under that. So as you know the structural activity relationship, if you are replacing any group or any functional group, so that will change in the structure, and they do have a certain change in the specificity or their activity if depending upon the concentration. Some are active in the low concentration, some are active in the higher concentration. So that's what depending upon the change in the structure they had classified. No doubt, but their mechanism is same. That is inhibitors of the cell wall synthesis. Cephalosporins are further classified into first generation, that is cefazocin, cefadroxil, cefexin, then cefectin. Second generation are cefizil, then cefenadol or ceponsid or cepoxin. Third generation are cefadine, cefexime or cipoprazone, cipotaxime, and fourth generation are cipivine. So how they are classified into fourth generation, second generation, third generation. So as they have done the modification in that every parent molecule. So that's what we can say at the fourth generation, second generation, and third generation and fourth generation. You know that in medicinal chemistry, you are keeping lots of drugs, and you can have the nomenclature depending upon that generations. Okay, so this is the overall classification of the uh, first mechanism, that is you can that the cell wall synthesis inhibitor. So you can see on the screen whichever the examples are there, they do have the common mechanism, that inhibition of the cell wall synthesis. And if there is inhibition of the cell wall synthesis, there will be the you can, depending upon the concentration, either there will be killing sidal or static effect may takes to the particular that cell. Okay, and there is one another class, that is beta lactamase inhibitors. Correct. You know the beta lactam ring. We have seen the beta lactam ring over here. The beta lactam ring is there. Beta lactamase inhibit or cleave or break down the these beta lactam, so that the effect of the or the efficacy of these penicillin like antibiotics is inhibited. So that to avoid this, there are certain beta lactamase inhibitors. The examples are clavulanic acid, sulbactam, or tazobactam. What is the function of beta lactamase inhibitor? They inhibit the beta lactam. So that what will happen? There will be the effectiveness or the efficacy of that particular drug will be not hampered. Correct? So these are the first mechanism which we have tried to understand. Now we'll see one by one what are the penicillins. This penicillin again may be classified into three: narrow spectrum, again penicillinase resistance and penicillinase sensitive. Broad spectrum, penicillinase sensitive. So the examples you can see as methicillin, nafcillin, and oxacillin. You just try to mark up 2 3 examples from each subclass. If the question is likewise explain penicillin mechanism or classify the penicillin or classify the inhibitors of the cell wall synthesis. So at that time, depending upon the type of question and the mark system, you have to explain. So narrow spectrum penicillinase sensitive, the example is penicillin G, that is benzyl penicillin and penicillin. So what is the use of that? It is used in the infection caused by streptococci, pneumococci, gonococci, meningococci. So whichever many the infections are there, likewise pneumococci, likewise they are used for, or they causes the pneumonia. So if you want to inhibit the pneumonial infection, so definitely will have to use the benzyl penicillins or other penicillin B like drugs. Another class is broad spectrum penicillinase sensitive. So definitely broad spectrum means what? They are acting on gram positive as well as gram negative. So the classical example is ampicillin and amoxicillin. Correct. So these two drugs can we can use for the treatment of the disease. Now, extended spectrum penicillin is sensitive. We have seen narrow, broad, and extended. So they do have the extended spectrum. Example, you can see that carbanicillin is there, piperacillin is there, as well as picaracillin is there. So this infection is due to E. coli or E. coli or influenza or gram negative or rods likewise pseudomonas aeruginosa. So if you are suffering from the infection likewise pseudomonas aeruginosa, you'll have to go for the carbonicillin. How you have selected only these? So they do have a certain research, and depending upon the research outcome, you can say that yes, we can use this antibiotic for treatments. You know that likewise in COVID-19, we are using the amoxicillin. If you do have the lots of infection, so it may be a lung infection. If you have the throat infection, so for that you're using lots of experiments we have done, and we have banned also. You know that remdesivir we have banned. So likewise we have banned lots of drugs. How you have concluded? So depending upon the experiments, depending upon the research, then you have decided that yes, we can use this drug or this not. So they can be combined with aminoglycosides for the initial treatment of serious infection. It may be a septicemia or endocarditis when this bacterial causes has not been identified. So if you don't know the what is the exact cause, so definitely you'll have to go for the various experiments. So at that time you can use this extended spectrum penicillinase sensitive antibiotics. Right? The major mechanism of bacterial resistance to penicillin is the formation of beta lactamase, that is penicillinase. So there are chances of the creation of the resistance to penicillins. At that time also you can use in a mixture or in combination of the other drugs. So clavulanic acid, sulbactam, and tazobactam are the inhibitors of beta lactamase and are used in combination with penicillins to prevent the inactivation. So you can see that you can go for the various combination of the drugs in the extended spectrum penicillinase sensitive drugs. Correct. So we have seen right now the classification of the penicillin. So penicillin classification we seen the depending upon the mechanism of action, depending upon the spectrum of activity. Now you can see another classification depending upon the spectrum with sensitive of for the penicillinase as well as resistance to the penicillinase. So these narrow spectrum penicillinase sensitive penicillins, broad spectrum penicillinase sensitive penicillins, as well as extended spectrum penicillinase sensitive penicillin and beta lactamase inhibitors. So this is the overall classification of the penicillins. So what I will suggest you might be in a confusion that which classification we have to follow. So you follow mainly depending upon the two types of the classification based on the spectrum of activity, and another is based on their mechanism of action and their sensitivity toward the penicillinase as well as beta lactamase. Correct. Now, what is the mechanism of action? So these beta lactam antibiotics are bactericidal. Now again, third class, that is whether it is bactericidal or bacteriostatic. So these beta lactam antibiotics are bactericidal. They inhibit the cell wall synthesis by the following steps. How they are inhibiting the cell wall synthesis? So they are binding to the drug specific receptor. So there are certain drug specific receptor, that is penicillin binding proteins are there. Penicillin is binding to specific proteins, so that what will happen? Inhibition of transpeptidase that act to cross link linear peptidoglycan chain that form the part of the cell wall. Correct? So they inhibit the transpeptidase and activation of autolytic enzyme that causes lysis of the bacterial cell wall. So if you see the mechanism of these beta lactam antibiotics, they inhibit the cell wall, and you know that if they are inhibiting the cell wall, what they are doing, they are binding with the penicillin binding proteins. They inhibits the transpeptidase, and which will lead to the autolytic enzymes. Correct. So this is the basic mechanism through which all antibiotics, all beta lactam antibiotics are acting. Now you know that if you want to study the pharmacology of the beta lactam, so in that what you have to write, you should write the what is the clinical condition of that particular disease, or what are the pharmacodynamic or pharmacokinetic parameters. In the pharmacodynamic, you have to write about the what is the mechanism of action, what are the classification, what are the absorption, distribution, metabolism, excretion, what are their application, what are the adverse effect of that particular drug. So if the terms is pharmacology, in the introduction part of the syllabus you can see it's clearly mentioned that what we have to include if the term is pharmacology. Correct? So these penicillins are very in acid stability and in oral bioavailability. They are polar compounds. They are as they are polar compound, so they are excreted in unchanged in the urine. So you can uh, find out the concentration of the antibiotic in the urine as they are excreted in the unchanged form. Probenecid inhibits the tubular secretion of penicillins. The oral preparations are penicillin B and amoxicillin. Yes, there are a certain these penicillins, they are inactive through the oral preparation. So we have to change the route of administration. We can go for IV or IM. So ampicillin and sulbactam combination, and this ticarcillin plus clavulanic acid we can use by IV or IM. There are other preparations which are effective by the oral as well as IV or IM routes. Most penicillin cross the blood-brain barrier only when the meninges are inflamed. So you know that the tight glide junctions of the blood-brain barrier is there, through which it's very not every drug is passing through the blood-brain barrier. So if there is inflammatory condition, then and then only these penicillins can uh, pass the blood-brain barrier. Otherwise, they are not crossing the blood-brain barrier. Now we have seen this toxicity that these antibiotics, they do have a certain adverse effect or the allergic reactions. In that hypersensitivity reaction is there, which may cause the rashes, then pruritus, fever, urticaria, and hemolytic anemia. So definitely, they do have certain hypersensitivity reactions. If you're using a low concentration, the hypersensitivity reaction will be less. If you're using more, so hypersensitivity reaction will be more. The metabolites, likewise penicillic acid, which reacts with the host proteins and which causes the immune reactions. The anaphylaxis can also happen, leading to shock or death. So it occurs in 5 to 10% of those receiving the penicillins. The pain and inflammation of the injection site. Yes, there are chances of the pain and infection at the injection site if you're going for the IV or IM. Another toxicity is GIT disturbance. So nausea and diarrhea with oral penicillin, especially ampicillin. These are the common problems with the antibiotic. But for you know that if we are taking the antibiotics several times we are taking the antacids. So it may alter the what we can say as environment of the stomach. That's what we are using. There are a certain cation toxicity. The toxic effects from sodium or potassium may occur when high doses of certain penicillin or certain salts are used in the patient with cardiovascular or renal diseases. Correct. So these are the three toxicity through which it may be a cause of their action. So this is how we have tried to complete the overall the first part, that is the penicillins or beta lactam antibiotics, or how they are acting, whether through uh, the sensitive to the penicillin or resistance. So that was a brief information about the penicillin. Now coming to the next point, that is cephalosporin. The cephalosporin from cephalosporin species. It is same antibiotic. They do have the mechanism of the penicillins. They do have the cross allergies with penicillins, and the allergic reactions or hypersensitivity reactions are common as like of penicillin. Some cephalosporins antagonize the vitamin K, which may induce the excessive bleeding. You know that vitamin K is acting as a coagulant, so that it inhibits, it forms the, uh, it avoids the blood loss. Some cephalosporins block the alcohol oxidation, so they do have the disulfiram like effect. You know the disulfiram is a drug which is used for the, if the person is addicted from the alcohol. So disulfiram inhibit the metabolism of the alcohol, so that there's a formation of the acetaldehyde, uh, and which will causes the certain allergic reaction, so that person, if he is habitual for the alcohol intake, they just try to avoid to take the alcohol due to the disulfiram like drug. So cephalosporins, some cephalosporins, they do have same effect. Correct. Now they have classified into generations, that is 1 to 4. Then they increasing the activity against gram negative bacterial and anaerobes. Correct. Also, they increasing the resistance to the destruction by beta lactamase. Okay, and also they increases the ability to reach the cerebrospinal fluid. So whichever the loopholes of the penicillins were there, that has been overcome by the cephalosporins. Correct. Then again, we have seen this fourth generation, second generation, third generation, fourth generation. So these fourth generation, that is cefazolin, second generation cefaclor, again whether they are acting on the gram positive bacteria or gram negative bacteria. So they are also have the specificity whether they are acting on the gram negative or gram positive. Third generation are cefotaxime, which are active against gram-negative bacteria, or active against Pseudomonas aeruginosa, or penetrates the CNS, likewise in meningitis. So if there is a infection to the CNS, so at that time definitely we can use the cephalosporin likewise drugs. So that was related with the cephalosporin. So you can see on the screen, we can take only 2 3 examples on the first generation, second generation, third generation, and fourth generation. They are classified depending upon the modification in their chemical structure, but they do have the same pharmacological actions as like of beta lactam antibiotics. Correct. So what is the mechanism action? So we know that the cephalosporins, they do have the similar action as of beta lactam antibiotics. Correct? That they are acting as a bactericidal at the uh, higher concentration. If you see the pharmacokinetic, only few cephalosporins are administered orally and more are administered parenterally. So they are excreted mainly in the urine. So definitely they are excreted and unchanged in the urine. Likewise of penicillins. Coming to the next point, that is toxicity or the adverse effect. So they do have the similar toxic reaction like by nausea, vomiting, diarrhea, anorexia, or abdominal pain, or flatulence. They do have the common effects. Also, the hypersensitivity reaction. So skin rashes are there, anaphylactic shock are there. These reactions occur less frequently than with the penicillins. The cross hypersensitivity between the different cephalosporins may occur. So there are chances of the drug-drug reactions. There is a cross hypersensitivity reactions may occur. Also, the patient with the history of anaphylaxis to the penicillins should not be treated with an cephalosporins. Correct. So you know that if there is any allergic reaction, so at that time we should avoid to take the cephalosporins. Correct. Also, if we are using the IM or IV, so there are chances of the pain at the injection sites or phlebitis. After IV administration, there might be chances of the inflammation. There are certain acute tubular damage, especially with the aminoglycosides, when administered together. So, if in a combination, the fixed dose combination, if you use, so there are chances of the damage to the tubules. The presence of the methyltetrazole groups, likewise cipaparazone or cifamendole, which causes the certain disulfiram-like reactions. I have explained you what is a disulfiram-like reactions. And the patient may experience the flushing, headache, nausea, vomiting, muscular cramps, or this may occur even up to 72 hours of the cephalosporin discontinuation. So, person may become habitual for such type of drugs, or there are chances of the certain withdrawal symptoms for the cephalosporins. Up till now, we have seen the penicillins, then the cephalosporins. Next one is carbapenems. In the carbapenems, the imipenem contains the beta-lactam ring structure with low susceptibility of the beta-lactamase. It is the broadest spectrum beta-lactam antibiotic. It is taken by the IV injection. So normally these carbapenems are the broad spectrum antibiotics. So we can use both uh, gram positive, negative, as well as in combination with the other antibiotics. So imipenem is rapidly inactivated by the renal dihydropeptidase 1. So it is always administered in combination with the cilastatin. So these, as the name indicates, that they are the extended spectrum. So definitely they are used in combination with other antibiotics. The combination increases the plasma life of the imipenem and inhibits the formation of potentially nephrotoxic metabolites. Correct. So both these combination are useful for the treatments. The adverse effects are of same. Likewise, they do have the GIT distress, skin rashes or allergic reactions. It may create certain confusions, seizures, or encephalopathy at the high plasma level. There is a partial cross allergic with the penicillin. The allergic reactions are also common for this. Correct. And the last point is monobactam, that is no activity against gram-positive bacteria or anaerobes. They are resist to the beta-lactamase. There no cross allergy with the penicillins, and the adverse effects are GIT upsets, skin rashes, and headache. So if you see the functioning of these penicillin, carbapenem, or monobactam, or cephalosporin. They do have the similar mechanism of action and similar pharmacokinetic parameters, and the spectrum of activity will be narrow or broad. And if it is broad, we have to mix with the other antibiotics. Correct? And The last one is non-beta lactam cell wall inhibitors. That is vancomycin is there. This vancomycin is a glycopeptide antibiotic which is active against most gram-positive organisms. They are administered mainly through the IV. It can be used orally just in case of intestinal infection because it is not absorbed orally. They are antibiotic associated with the pseudomonas colitis, and there has been particularly important in the treatment of the antibiotic resistance, likewise staphylococcal as well as enterococcal infections. Vancomycin resistance strains or enterococci have become widespread and recently in a few cases to the staphylococcus aureus have been appeared. Its side effect is local pain, which may be a severe and having a phlebitis. It may be related with the autotoxicity and it can lead to the deafness. Also, the red man syndrome, which is head and neck erythema, hypotension due to the histamine release. So, what is this red man syndrome? Where there is a hypersensitivity reaction, the more release of the histamine, so that the neck as well as the head become redness or erythematic reactions occur, or it may lead to the hypotension. Correct? So that was the brief information about the introductory to part of the chemotherapy. Then we have tried to see the what is broad spectrum, what is narrow spectrum, what is extended spectrum, what is bactericidal, what is bacteriostatic. Then we have seen the classification of the antibiotic depending upon the mechanism of action. That we have seen the inhibitor of the cell wall synthesis, inhibitors of the protein synthesis, inhibitors of the nucleic acid synthesis. Then we have started with the inhibitors of the cell wall synthesis. In that, we have tried to see the classification. Likewise, what are the beta-lactam antibiotics and other antibiotics, penicillins, cephalosporin, carbapenem, or monobactam. The cephalosporin are again classified into first generation, second generation, third generation, and fourth generation. We have tried to see the beta-lactamase inhibitors, other antibiotics likewise vancomycins are there. So I think the most part of the introductory as well as the antibiotic classification we have completed during this first lecture. Okay, I will try to share you the this PowerPoint. Also, I will share you. I'll try to share you some videos I did for the antibiotic classification. Hello.
Hello, sir.
हाँ सर. एक 5 मिनट ब्रेक घेऊन कंटिन्यू करू की समजू.
Yes, sir.
Shall I continue or I will share one video
Yes, sir. Please.
that
Other beta-lactams bind to proteins called penicillin binding protein, or PBP, which are bacterial enzymes that catalyze cell wall peptidoglycan synthesis. This binding interferes with cell wall synthesis and leads to cell lysis and destruction of the bacterium. Natural penicillins are effective against gram-positive cocci, anaerobic pathogens, and spirochetes. Penicillin G is also effective against the gram-negative coccus, Neisseria. Semisynthetic penicillins, which are chemically synthesized analogs, are effective against many gram-negative bacilli. Penicillin G is the first commercially available penicillin. It is poorly absorbed when administered orally due to acid inactivation in the stomach, but well absorbed if administered intramuscularly. The drug is also excreted rapidly in the urine. Penicillin V and some semisynthetics, such as ampicillin and carpenicillin, are resistant to acid and so can be administered orally. Subsequently, they are better absorbed, have greater bioavailability, and an extended duration of action.
Okay,
Penicillins and other beta-lactams
you
bind
have
to
seen
proteins called penicillin.
in this video. So you have seen this video how the penicillin is acting, how these penicillin, they do have a specific binding sites, and through which these drugs are acting, and so that there will inhibition of the cell wall synthesis is taken place. Again, we can see one video.
Structurally, most bacteria consist of a cell membrane surrounded by a cell wall, and for some bacteria, an
Voice is
additional
audible,
outer
sir?
layer.
Voice is audible, no?
Yes, sir, yes. It is audible.
Internal to the cell membrane is the cytoplasm, which contains ribosomes, a nuclear region, and in some cases granules and/or vesicles. Depending on the bacterial species, a number of different external structures may be found, such as a capsule, flagella, and pili. In gram-negative bacteria, the gap between the cell membrane and the cell wall is known as the periplasmic space. Most gram-positive bacteria do not possess a periplasmic space, but have only periplasm, where metabolic digestion occurs and new cell peptidoglycan is attached. Peptidoglycan, the most important component of the cell wall, is a polymer made of N-acetylmuramic acid, alternating with N-acetylglucosamine, which are cross-linked by chains of 4 amino acids. The function of the bacterial cell wall is to maintain the characteristic shape of the organism and to prevent the bacterium from bursting when fluid flows into the organism by osmosis. Synthesis of the peptidoglycan and ultimately the bacterial cell wall occurs in a number of stages. One of the first stages is the addition of 5 amino acids to N-acetylmuramic acid. Next, N-acetylglucosamine is added to the N-acetylmuramic acid to form a precursor of peptidoglycan. This peptidoglycan precursor is then transported across the cell membrane to a cell wall acceptor in the periplasm. Once in the periplasm, the peptidoglycan precursors bind to cell wall acceptors and undergo extensive cross-linking. 2 major enzymes are involved in cross-linking: transpeptidase and D-alanine carboxypeptidase. These enzymes are also known as penicillin-binding proteins because of their ability to bind to penicillins and cephalosporins. Eventually, several layers of peptidoglycan are formed, all of which are cross-linked to create the cell wall. Gram-positive bacteria may have more layers than gram-negative bacteria and thus have a much thicker cell wall. Beta-lactam antibiotics include all penicillins and cephalosporins that contain a chemical structure called a beta-lactam ring. This structure is capable of binding to the enzymes that cross-link peptidoglycans. Beta-lactams interfere with cross-linking by binding to transpeptidase and D-alanine carboxypeptidase enzymes, thus preventing bacterial cell wall synthesis. By inhibiting cell wall synthesis, the bacterial cell is damaged. Gram-positive bacteria have a high internal osmotic pressure. Without a normal rigid cell wall, these cells burst when subjected to the low osmotic pressure of their surrounding environment. As well, the antibiotic penicillin-binding protein complex stimulates the release of autolysins that are capable of digesting the existing cell wall. Beta-lactam antibiotics are therefore considered bactericidal agents. Bacterial resistance to beta-lactam antibiotics may be acquired by several routes. One of the most important mechanisms is through a process known as transformation. During transformation, chromosomal genes are transferred from one bacterium to another. When a bacterium containing a resistance gene dies, naked DNA is released into the surrounding environment. If a bacterium of sufficient similarity to the dead one is in the vicinity, it will be able to uptake the naked DNA containing the resistance gene. Once inside the bacterium, the resistance gene may be transferred from the naked DNA to the chromosome of the host bacteria by a process known as homologous transformation. Over time, the bacterium may acquire enough of these resistance genes to result in a remodeling of the segment of the host DNA. If this remodeled DNA segment codes for cross-linking enzymes, i.e. penicillin binding proteins, the result is the production of altered penicillin binding proteins. These altered penicillin binding proteins can still cross-link the peptidoglycan layers of the cell wall, but have a reduced affinity for beta-lactam antibiotics, thus rendering the bacterium resistant to the effects of penicillin and other beta-lactam agents. This transfer process has resulted in penicillin-resistant S. pneumoniae through the acquisition of genes from other naturally occurring penicillin-resistant Streptococcus species. A second important mechanism by which bacteria become resistant to beta-lactam antibiotics is by the production of enzymes capable of inactivating or modifying the drug before it has a chance to exert its effect on the bacteria. Depending on the bacterial species, the gene coding for these enzymes may be found as part of the host DNA or on plasmids, which are small, self-replicating units of genetic material. Bacteria are capable of passing these resistance plasmids to each other by conjugation. When two bacteria come into close contact with each other, a small channel is created between them, which allows one of the bacteria to pass a copy of the resistance plasmid to the other. If the plasmid is transcribed and translated, the bacteria will begin to produce inactivating enzymes. These enzymes, capable of destroying beta-lactam antibiotics, are known as beta-lactamases. In gram-positive bacteria, the beta-lactamase enzyme is generally inducible, resulting in a large amount of enzyme being produced in the presence of the drug. In gram-negative bacteria, the beta-lactam enzymes are produced constitutively, i.e., even when the antibiotic is not present. Gram-positive bacteria release the beta-lactamase enzyme from the cell into the extracellular environment, where it inactivates the drug before it enters the bacterial cell. In contrast, gram-negative bacteria retain the beta-lactamase enzyme within the periplasmic space, resulting in a more efficient mechanism than gram-positive bacteria. Ultimately, the destruction of the beta-lactam ring of the antibiotic renders it incapable of binding to the penicillin binding protein, and thus the bacteria become resistant to that drug or class of drugs.
Okay, so whatever we have discussed, same thing I'll try to explain you through the animation, where exactly the protein binding sites are there, how the cell wall synthesis inhibition is taking place, how the release of the autolytic enzymes are there, so that the cell organelles cannot hold their original position. So these things I will try to explain you. So we have tried to complete the first part. Now I do have another mechanism so that we can videos so that we can understand how the tetracyclines are acting or through how the chloramphenicals are acting. So I'll try to show you one by one. The now we'll see what is the gram positive and gram negative bacteria.
Today we're going to be talking about cell walls of bacteria.
Another one thing. One, three videos. Okay, I think they do have signaling that we can share only three videos. Uh, so that's all from my side. I will take another lecture for the next mechanism, or the we can have another. Nirmal sir, are you there?
Hello, sir.
Yeah.
Yeah, tell me.
Yeah, sir. Actually, we can share only three videos as per the stream yard.
Okay.
So we'll continue tomorrow also.
Yes, sir. Yes.
Yes.
Please.
Okay.
Yes.
Remaining part I will try to complete tomorrow. No problem.
Yes. And thank you for this very good lecture and nice
Yes,
presentation.
sir. Yes, sir. Definitely, it's my pleasure to share my knowledge with your students.